Skin changes at life's end. Scale. Introduction. What causes the skin to weaken and break down at life's end? Choose one of the following options. 1. Less blood being supplied to the skin. 2. Less oxygen being supplied to the skin. 3. All of the above. Correct. The skin may weaken and break down at life's end because there is less blood and oxygen being supplied to it. A small amount of pressure may cause a pressure ulcer for someone who is dying. Select true or false. Correct. Because the skin weakens at life's end, even a small amount of pressure may cause a pressure ulcer. Skin tears, pressure ulcers, or other skin changes may develop at life's end even if the best care possible is given. Select true or false. Correct. The skin is not working properly at life's end. This may cause skin changes despite the best care possible. You should always choose a treatment plan with the goal to heal any wounds. Select true or false. Correct. There are many options for treatment. However, it is important to remember that some wounds are unable to heal at life's end. You should always choose a treatment plan and stick with it. Select true or false. Correct. It is important to recognize that a treatment plan may change as the patient's condition changes. Thank you for using Explain.